So today I'm with a patient who sometimes has pain in her wrist and some weakness in her hand. This is somebody who uses a computer a lot, and that's very common. Why wait until it's in bad shape? Why not go ahead and find out what it needs and adjust it very gently? So today I'm with a patient who sometimes has pain in her wrist and some weakness in her hand. So what I'm going to check is whether that wrist pain, weakness in her hand might be coming actually from her wrist. Maybe it's from her elbow, maybe it's from her shoulder, or maybe even it's from her neck. So I'm going to do some tests right now. I'm going to show you how I evaluate that, and then what we do about whatever we find. So what I want you to do is put your hand like this, pull tightly. Can you hold it right together? And she can't hold it together, which indicates to me that there are some bones here in the wrist that are out of place. Now, it could also be her elbow. I check that a different way. Put your fingers together and hold, and that tells me something about her elbow. Her elbow is okay. Now, I also want to know, could her hand pain be coming also from her shoulder? So I check that by finding a muscle that's nice and strong and tight and push up. And her shoulder is okay. Could her wrist pain be coming from her neck? Push. In this case, it isn't. So what I'm going to do is adjust her wrist. So push these two fingers together again. And she can't do that. She should be able to hold that nice and tight. I'm going to adjust your wrist. And you guys can't hear that or feel that, but we're feeling things moving. Push, and now she can hold it. That's just tight as can be. Hold tight, push, excellent. Now turn it over, push. Now her elbow's showing up. Okay, so it's not just one and done. Once something is adjusted, something else might show up. So I'm going to adjust this. This may be a little tender when I do it. Just allow your shoulder to relax. Good. And now let's see if that was enough. Push, and that was plenty. Okay, so now let's see. Let's recheck the shoulder. Push, shoulder's still okay. Push, neck is still okay. Good. Now let's do the same thing on the other side. Push, same thing. Now, this is somebody who uses a computer a lot, and that's very common. Push them together, hold, and now turn it over. Let's check the elbow. Push. Now this elbow is showing up. Push. Just relax there. Good. Now push tight. Now that's better. Now I'm going to use this as my indicator muscle. Push up, and we're going to see if this shoulder's all right. Now look, that shoulder's not all right. See, now this is a person who didn't really know too much about pain yet, but we're finding it before it turns into a painful situation, because in my practice I'm interested in function. I'm less interested in symptoms, because symptoms only occur after something's been a problem for a while. So I want to know about function. And even if somebody comes into me and says, I have this symptom and I have that symptom, I might have wrist pain, or I might have shoulder pain, or I might have thyroid problems, or I might have really bad periods, or I might have lost my vitality. This happens to a lot of men, for instance, and women and men also are often just really, really tired. These are all things that can happen in a person's life, indicating that there's some functional imbalance, and that's what I'm really interested in. So this patient has never really expressed to me that she has shoulder pain, but yet when I find out with an indicator muscle whether there's something going on there, this would not show up in an x-ray or anything. But why wait until it's in bad shape? Why not go ahead and find out what it needs and adjust it very gently. Push up. Now I'm going to find out what direction it needs to go in. Push. And now I know what direction it needs to go in. I'm going to use this little instrument called an activator instrument. And I'm just going to tap gently on the shoulder joint. And let's see if that was all it needed. Push. There it was. Now I'm going to check her clavicle. Push. Now I also do this with people who do have neck pain and that kind of thing. And now let's go back and recheck that wrist. Push. It's still okay. Good. And push. It's still okay. And then as a general adjustment, I like to just give the joints of the wrists, the fingers, some space. And that just feels good, doesn't it? Yeah. Okay, so that's how I do adjustments for the carpal tunnel, and people would come in on a repeated basis, and then we would review some ergonomic or workstation types of adjustments that they can make at home to make themselves safer. Please comment below, and I'll be happy to have a conversation with you.